Hi, I'm Ryan. I'm going to be your nurse today. Can you state your name for me?
Chandler Woolweaver,
When's your birthday?
10/6/95.
Patient appears to be in no distress and resting comfortably at this time. Can you tell me what year it is?
2020.
And do you know where we are right now? What city?
Maslin.
Okay. Patient is alert and oriented to person, place, and time. Check the patient's skin. Patient appears to be pink, and skin turgor is immediately released back. Patient has hair on his arms and hair on his head. We're going to check the chest for symmetry as well as rate and rhythm. Patient's breathing about 16 times a minute, and rhythm appears to be normal. We're going to assess lung sounds. Go ahead, sit up for me. We're going to do 10 points on the front. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now we're going to do 20 on the back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Patient's lungs appear to be clear. If patient had crackles, we would suspect congestive heart failure. If patient had wheezing, we would suspect asthma or anaphylaxis. Go ahead, lay back for me. Next, we're going to check the patient's heart for any murmurs or gallops. We're going to do the aortic valve, which is the second intercostal space, right side of the sternum. Then we're going to move to the pulmonic, which is the second intercostal space, left side of the sternum. Erb's point, which is third intercostal space, left side of the sternum. Down to the tricuspid, which is the fourth intercostal space, left side of the sternum. Finally, the mitral, which is the fourth intercostal space on the midclavicular line on the left side. We're going to check an apical pulse. Patient's heart rate appears to be 74 times a minute. Regular rhythm. No murmurs, gallops, or slurring involved. Next, we're going to check the peripheral vascular. We're going to check all the patient's pulses: radial, ulnar, brachial, carotids, femoral, popliteal, dorsal pedis, and posterior tibial. Patient appears to have pulses in all locations. We're going to also check for edema in the legs on a 0 to +4 edema scale, +4 being pitting of more than 10 seconds on both legs. Patient does not appear to have any edema. Patient will put at a 30-degree angle to check for JVD, which would be an indicator of congestive heart failure or fluid overload. Patient appears to not have any JVD at this time. We would also check for lymph nodes. One would assess those in instances for possible infections. They would be swollen and tender. We'll move to the abdomen. We'll auscultate abdominal sounds, starting with the right lower, right upper, left lower. Bowel sounds are present. We would also check for color and condition. Patient appears to have no distension or pain. Any tenderness when I push and let go. Okay, no tenderness. We would also percuss on the abdomen. If we heard tympany, it would be an open area or air. If we heard dullness, it would end up being something in there, something in the gastrointestinal tract. We would move to urinary. Or when was your last bowel movement?
An hour ago.
How often do you have bowel movements roughly a day? What's your pattern?
5.
We would move to urinary. Any pain or discomfort when you urinate? Any foul odors, odd colors, any redness?
No.
Okay. Next, we would move to neurological. Patient was alert and oriented when we first began. Let me see your hands. Go ahead, squeeze my fingers as hard as you can. Good. Go ahead, try to raise your arms up against me, and now push down. Okay. Pull towards you, and now push me away. And check the legs. Go ahead and pull your toes to your nose and push down like you're driving a car. Okay. Go ahead and stand up for me. Walk towards me. Patient's gait appears to be normal. Go ahead and turn around. Walk heel to toe back for me. Okay, gait is normal. I'm going to check your eyes. Go ahead and follow this light with your eyes only. Okay, check the patient's pupils. Bright light in your eye. Patient's pupils appear to be 3 millimeters and equal and reactive. Go ahead and stand with your feet straight together for me. Hands down at your sides. Okay, no swaying. Go ahead and close your eyes for me. Okay, patient has no swaying with that as well. Go ahead and have a seat. Go ahead, lay back. Okay, patient had a negative Romberg test. Going back to abdomen real fast, we would check for girth. We would use a tape measure and measure the girth with the patient's abdomen. Go ahead and open your mouth for me. Gums are pink. Teeth are all intact. Then we're going to move to joints. We're going to check all of the joints. There's no redness or soreness. Go ahead and bend your elbow. Okay, relax. Can you move your shoulders straight out for me? Put your arm up and down. Range of motion on the right side is good. Do it again with the left. Bend your elbow, straight up, and out, and down. Okay, range of motion good there. No redness or tenderness to the knees. Go ahead, bend your legs. Okay. Good on the right, good on the left. No redness or swelling or tenderness to the ankles or the hips. We would check muscle strength on a scale of 0 to 5, 5 being normal strength, 4 being good strength with less on the resistance, and a 3 being weakness and no resistance strength at all. Do you do testicular self-exams?
Sure.
Okay, the best times to do those would be in a warm shower prior to washing anything. Do you have any questions for me?